My name is Dr. Sal Rachbeck, and I am the Chief Clinical Officer for Haven Health Management. In the last 27 years, I have treated hundreds of patients with addiction of all sorts and depression or related mental health conditions. One of the hardest things for them has been to recognize depression symptoms. Some are subtle, others are more obvious. Let's discuss the top 11 symptoms of depression that signal a need for treatment. Depression symptoms may vary from person to person. Here are the most common symptoms of depression. Number 1, depressed mood. Major depression and persistent depressive disorder are characterized by a depressed mood. A person suffering from major depression is depressed for most of the day. Children and teenagers, on the other hand, may look irritated rather than depressed. For at least 2 years, people with persistent depressive disorder experience a depressed mood on more days than not. To receive a persistent depressive disorder diagnosis, individuals must have been experiencing this for at least 1 year. Number 2, decreased interest. The second symptom of major depression is a loss of interest or pleasure in what was once an enjoyable activity. This is also known as anhedonia. Anhedonia symptoms can be classified into 2 categories: physical anhedonia, which makes it difficult to enjoy sensory pleasures, and those people who suffer from social anhedonia, who find it difficulty to enjoy social interactions. Number 3, changes in appetite. A change in your eating habit is another sign of depression. Some people experience a decrease in appetite as a result of this. You may have to force yourself to eat, since eating has completely lost its appeal. Sadness or feelings of worthlessness can also contribute to overeating. Number 4, sleep disturbances. Sleep disruption is seen in up to 90% of depressed adults. It can manifest as either difficulty sleeping, otherwise known as insomnia, or excessive sleeping, hypersomnia. The most common is insomnia, which is thought to affect 80% of patients with depression. Sleep problems may be both a symptom and a cause of depression. Number 5, fatigue. Chronic fatigue can be a sign of both persistent depressive disorder and major depressive disorder. This loss of energy can impair your ability to function normally. Perhaps you don't feel well enough to care for your children or perform your housework. The fatigue that accompanies clinical depression can be overwhelming at times. Number 6, feelings of guilt and worthlessness. Depression can have a detrimental impact on everything, including how you perceive yourself. You may have negative, unrealistic thoughts about yourself, such as feeling you are worthless. You may also have difficulty letting go of past mistakes, which may result in feelings of guilt. Depression is characterized by excessive, unwarranted guilt and feelings of worthlessness. Number 7, difficulty concentrating. Depression causes trouble concentrating and making decisions. This effect has been observed in older adults in particular. They may notice that they are having difficulty processing thoughts quickly. Number 8, recurring thoughts of death. Major depressive disorder often has recurring thoughts of death that go above the fear of dying. A person suffering from major depression may consider suicide attempt, or devise a particular plan to kill themselves. Number 9, unexplained pain. Depression can also be harmful to a person's physical health. Physical symptoms such as unexplained aches and pains are common warning signs of depression. Other common symptoms include joint pain, bloating, and backaches. Number 10, alcohol and drug use. Those with depression may turn to alcohol or drugs to cope with negative emotions such as sadness, loneliness, or hopelessness. According to the Anxiety and Depression Association of America, ADA, about 1 in every 5 people in the United States who have anxiety or serious mood disorders such as depression also have an alcohol or substance use disorder. On the other hand, the same proportion of people who have a drug or alcohol use disorder also has a mood disorder. Number 11, low sex drive. Some medical professionals believe that changes in sexual desire are an important sign. When a person is depressed, their libido may decrease for a variety of reasons. These are some examples: fatigue, loss of interest in pleasurable activities such as sex, and low self-esteem. In conclusion, it's important to note that individuals suffering from depression do not need to live in pain, whether it be physical, mental, or the combination of both. There are plenty of resources available to treat this ailment and provide those suffering with an opportunity to heal and live healthier and more productive lives.